Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Anwar Shahzad. Today we will discuss another important topic, that is a heart failure. As we know that heart should function properly for the accurate or functionful life, and it is the heart which pushes the blood throughout the body, and so that it may supply the nutrition to the cells and bring away the waste products, that is carbon dioxide, carbon monoxide, or other waste products. So the definition being that if the heart is unable to supply this blood at a sufficient rate for the proper function of the cells of the body. So if it is the blood which is pushed from the left ventricle during the systolic phase, under this pressure, the blood circulates through the body, through the arteries and the veins, and comes back to the heart, that is a right atrium. So this pressure is must, and there should be adequate quantity of the blood which is being pushed and at a sufficient rate, so that it should meet the metabolic demands of the body. So if there is any defect, any problem in the heart, so that it is unable to push, or it is not being properly filled, chambers are not being filled, then it leads to the heart failure. That is the right heart failure and the left heart failure. As we see the circulation again, that is the blood is pushed from the left ventricle, and by such a pressure that it goes from the arteries to the veins, then comes back to the right atrium, and then right ventricle. From the right ventricle, it is pushed into the lungs, and from the lungs, after getting sufficient oxygen, blood comes to the left atrium. From the left atrium to the left ventricle, and in between the atria and the ventricle, there are the valves which ensure the unidirectional flow. So the right ventricle, if it is unable, if there is a problem in the lungs, there is a resistance, then right ventricle will gradually become hypertrophic, and it may be inefficiently producing the pressure that is to the lungs. So then the blood will be pooled in the body organs from which the blood was coming, that is the lower limbs and abdominal viscera, liver, etc. And it will lead to the edema. And if the pressure, then the blood comes into the left atrium and the left ventricle. The left ventricle has to push the blood with a sufficient force, so that it may circulate through the body. And if there is a problem in the left ventricle, and it will not be able to push the blood in the sufficient quantity and with the sufficient force, then it will be called as a failure. That is a forward failure, and it is unable to contract or force the blood, or there may be a filling failure. That is during the systole, the blood is pushed. During the diastole, that is in between the two systole, then the chambers are filled, so that this blood may again should be pushed. So filling of the chambers is also must, so that, and the contraction and the pushing of the forward is also must. So if there is problem in the pushing the blood forward, that will be also a failure. And if there is problem in the filling, that is inefficient filling, that will be also a failure. So systolic failure and diastolic failure. So that the result being, the conclusion is that for the proper function of the body, the heart has to work efficiently, so that the blood should circulate throughout the body at a sufficient rate and sufficient quantity, and it should come back and again reach scheduled, recycled, so that this is must for the body function. So if there is a problem in the heart and the pushing, other in the receiving, then it will lead to the failure. The failure. So if the muscles of the heart, they are such stronger muscles that they uh, don't take rest, and continuously throughout life these muscles contract. So without rest they do the function, and so it is they are these muscles are very much strong as compared to other muscles. So other skeletal muscles and other muscles may take rest in some time, but the cardiac muscle they don't. And if there is any problem, that is the blood supply is hampered to the blood muscles, heart muscles, then it may lead to ischemia and heart attack and fibrosis, and the heart becomes weak. Or there is or other, that is there is constant pressure, other resistance to the in the circulation for the left ventricle, or in the lungs for the right ventricle. So these factors which this cause problem in filling the chambers and in pushing the blood forward, maybe the weakness of the heart, or other the narrowing of the valves, or other myopathies. Same thing, it's related to the this heart failure. So whenever you feel any edema, that is swelling of the feet and legs, or the shortness of breath, or orthopnea, that is shortness of breath on line, and on walking as well, one must evaluate his heart by doing different, going to the heart physician, and he will, of course, see the ECG and the echocardiography, the stress test, and other cardiac enzymes, and etc. etc. So the failure is it is some this disease which must be evaluated timely and get consultation from the heart specialist. And that is all. Thank you very much.